Happy New Year, everybody. Welcome back to the Right Path to Retirement podcast. What an appropriate name as we try to reset our course trajectories here for 2025. Host of this podcast is Jimmy Lynn. He's the president, founder, and financial advisor of Right Path Wealth Management. You can get in touch with Jimmy and the team at rightpathwm.com or 702-805-7000. Dial them up. Jimmy, so good to be on with you, and Happy New Year, sir.
Hey, Doug, how are you?
I'm doing great, thank you.
Good. Happy New Year to you.
I appreciate it. Yeah, it's hard to believe that as we get older, time goes faster. I think I know everybody's different, but I feel like that's true for everyone, right?
Everyone I talk to, it flies by. 2024 was a blur. It was a great year, but it was a blur. So, but we got this podcast started, and I think that we're delivering some great messages and educating a lot of people. So I'm excited for the upcoming year.
Yeah, I'm excited to hear what you have to say about all that we've dug into. By the way, the last episode, how we ended 2024, was why 59.5 is the magic number in so many respects and the things that opened you up to financially. The episode before that, we talked about when to take Social Security, because that's not just one magic number. It starts at 62, but you can take it all the way, I think, 62 to 70, right? You can go all the way through the years and decide when you want to take it, depending on how much money you get per month. This episode, we're going to talk about healthcare costs and retirement. But first off, Jimmy, because it's New Year's, a lot of Las Vegas locals don't go do Las Vegas things, right? But you did tell me there is something that's pretty interesting that happens on the Vegas Strip there at the strike of 12 midnight.
Yeah, and in Las Vegas, I mean, a lot of people come to Las Vegas to celebrate the New Year, but a lot of Las Vegans aren't there with them. So we're all in the suburbs doing our celebration. You know, we were at my brother-in-law's home celebrating New Year's like we do every single year. But the Las Vegas Strip, they shut it down. People are in the streets, and we don't have the traditional, countdown clock, or we don't have the Apple coming down like they do in New York. But it's really just all the hotels, they have their fireworks stations ready to go, and when it hits midnight, all the hotels start firing off their fireworks, and it's a pretty impressive spectacle to see it. But the hotels all participate, so that the sky is just bright as can be.
And I'm guessing you don't live close enough to be able to see that from a distance or anything, right?
No, you actually can.
Really? Wow.
Because of the way the Las Vegas Valley is, a lot of the suburbs were kind of on a hill, so you can see a lot of what's going on in the Strip. So we all sit around and watch the spectacle. It's actually a wonderful sight.
So you actually don't mess around with your own fireworks then, or do you?
Not at all. Why mess with that when you got this show going on?
That's fantastic. Yeah, I'm sure we'll run to the roof of our place if it's not too cold and see if we can see any good fireworks around there. We'll certainly hear them for sure in my area, suburb of Atlanta, Georgia. All right. Well, today we're going to talk about healthcare costs and retirement and how to navigate those, Jimmy. And I know you've seen every situation, it seems like, up, down, and sideways, but healthcare costs are no joke. If there's probably very few things we all can agree on, is that healthcare is super, maybe even too expensive. So how do you help retirees get through that?
Yeah, I mean, I hope the listeners, they definitely go back and listen to a lot of our episodes, because as you've kind of talked about, the different topics we've covered over the weeks, there's just always something you have to plan for as you get into retirement, and you have to know the ins and outs of, and healthcare is probably one of the most complex. And I feel like I always say that, but healthcare is another complicated topic that people have to be aware of, because it's such an important aspect of your retirement. So healthcare costs in general. Last episode, we talked about that magical number of 59.5 when you can access those retirement funds without any type of penalty. Mm-hmm. Well, there is another equally magical number, Doug, which is the age of 65. And I would say that most people I talk to, 65 is kind of their time where they're really considering retirement, because they have access to Medicare. Right. And so once you have access to Medicare, so just kind of give all the listeners a refresher on Medicare 101. But essentially, when you qualify for Medicare at age 65, you get hospital coverage, which is Medicare Part A. You get Medicare Part B, which is going outpatient services, going to see a physician. And then there's prescription drug plans and Medicare Advantage. So there's a lot of different parts that you have to start coordinating, but it does provide you with health care after you leave your employer. So that's why it's kind of that magic number. It's health care that you don't have to qualify for, and you just basically, you've paid into the system most of your life, and then you start reaping the benefits of that. Now, there are some premiums involved, and that's where there's a lot of planning. And when you start talking about costs, one of the premiums we talk about is Medicare Part B. So people think Medicare, this government program that takes care of seniors, should be covered because we've paid taxes for this, but that's actually not the case. Medicare Part B could be one of your largest expenses. It's a premium that each individual has to pay for that outpatient to see a physician, basically. For 2024, it was $175 a month. So as a couple, it may be about $350 a month. But one of the key things with that, as we talked about in previous episodes, is that is based on the income that you've earned. So depending on where your income lies in retirement, those Medicare Part B premiums could be a lot higher. There's something called IRMAA, IRMAA, and that's basically a surcharge on your Medicare Part B premiums. And we see a lot of people that worked hard in their retirement or in their working years saving for retirement, and you'll kind of see how this all works together, Doug, is that they have these Medicare Part B premiums that they want to pay for because they qualify for this government health program. But there's another government program called the required minimum distribution that we talked about, which actually increases your income. And that increase in income could actually increase your Medicare Part B premiums, which is IRMAA. So you see how it's all kind of interconnected, and you gotta work around those moving parts, and that's where a lot of the planning takes place. But Medicare would be where a lot of the healthcare costs are going to be incurred. You pay for that premium. Oftentimes, you also might get like a supplemental plan to cover some of the expenses that Medicare doesn't cover. There's things like Medicare Advantage, and that is the bulk of what I would say is the prime healthcare that most retirees get. Right, is going to be Medicare.
Yeah,
but again, that's at age 65. So what about those people that want to retire early? Because nobody necessarily wants to we don't want to tell all Americans that you pretty much got to retire at age 65, otherwise you're not covered. So a lot of people will actually, the Affordable Care Act or the ACA plans, those are basically the health market where if you're not covered by your employer, you can buy private insurance. So a lot of times people, they may hit age 60 where they have access to their retirement accounts, but they don't want to wait till 65 to actually retire when they get Medicare. To fill that gap, sometimes they'll do an ACA plan. And so that's a way to fill that gap. Now, there is a premium for that. And a lot of the pricing is also based on the amount of income that you show, because you can get really expensive coverage in the ACA plans, but it can be discounted based on you showing minimal income. So again, that's where some of the planning takes place, right? Some of these are retirees. We want to try to provide them with an income stream, but show as little income to the IRS as possible through the way we manage their accounts. And that way they can qualify for lower premiums for the plans that they purchase on the marketplace, because basically the government will subsidize them on some of the premiums as long as they don't show a certain amount of income.
Oh, that's part of the trick too. And so, and that's where they need somebody like you to plan through, right? Because the different things that trigger that or not. And I'm sure I can imagine the look you see on people's faces when you start trying to explain that to them.
Right. Absolutely. I mean, anyone listening to this podcast right now, their head's probably spinning, thinking about how you have these different options and how your premiums are based on different trigger points and how different income sources can cause different taxation, which can cause higher premiums. I mean, there's so many moving parts, but that's where planning takes place. And that's really, really where the value of an advisor comes into play, is looking at somebody who, hey, I just turned 6 years old. So now I have this retirement account. I don't know what to do with this retirement account, but I know I want to utilize it in retirement and I want to retire early. So how do I get my health coverage? But how do I not let this money affect my premiums. With all those moving parts, that's where there's a lot of confusion. So our goal is really to kind of understand what the objective is, and then how can we plan around that to reduce those healthcare costs? Because we're talking about, those gap years where you're paying for your private insurance through the ACA plans. Then you hit Medicare age, and you want to make sure that you don't trigger higher Part B premiums or Part D premiums. And then we haven't even touched on long-term care, Doug.
Oh, sure. Yeah.
Right?
Well, and that's the one that people probably underestimate the most.
That's the one where, that's the last one you plan for, just because it's kind of like everything else that is difficult. You kick the can down the curb, but long-term care, can eat up all the money that you've saved up over time. So if your goal is estate planning or passing on assets to your heirs, or even a surviving spouse, for example, you want to do your best to make sure that if you have some type of condition where you lose some of your cognitive abilities, or you just lose your ability to take care of yourself, and you have to go to some type of facility, or you need somebody during your older years to come and help you, there's a huge cost for that. But there are ways to plan for that, because if you buy long-term care just as a separate policy and you're in your 60s, I mean, the costs are almost unaffordable for the majority of Americans. But there are other options you can utilize to make sure that you have some type of long-term care coverage along with everything else that we talked about.
There's regular health care, there's Medicare, there's long-term care, there's Medicare Part A and Part B, there's the IRMAA charge, which I'm going to be honest, first time I've heard anybody speak of that around me, and then all the tax implications for when you get into required minimum distributions are starting to draw from your qualified retirement accounts there in retirement. So with all that stirred together, somebody's hearing this and their eyes are as big as silver dollars, all right, and they're just like, what? I'm just used to having insurance taken out of my paycheck and my employer handling it. Well, you don't probably have an employer in retirement, right? What do they do, Jimmy, if somebody's hearing this and they want to get in touch with you to have more questions answered?
Well, Doug, I would encourage everyone listening, because anyone in the audience is probably in that phase where they are starting to plan for retirement, or maybe they're already in retirement and they just want to kind of get all their ducks in a row. Our office, we specialize in working with pre-retirees and retirees. So that's why all of our topics are covering things like Social Security, Medicare, tax planning in retirement, RMDs. So what I would do is I'd encourage anyone listening to either give us a call at our office at 702-805-7000, or go to our website, rightpath2retirement.com, and you can reach out to us there. And just going to give you an example of some of the things we talk about with the prospects during their complimentary consultation, Doug. We just look at their situation and kind of see if we can help them create an income plan to make sure that they're able to replace those paychecks that they've been receiving over their working years. We look to identify if there's some tax planning strategies that we can help them implement, or at least make some suggestions. And oftentimes people ask us to do a portfolio analysis as well, just to make sure that the way they're invested right now will be able to sustain itself during all market conditions. So those are just a couple examples, but really just any questions that the listeners have, I encourage them to just come in. There's no obligation. They're not going to be committed to anything. We're just going to hopefully give them some free, really good advice. And if they want to look further into relationships with us, we're open to talking about that.
No, well, good. That's the great thing. People sometimes just like to stick a toe in there before they jump all the way underwater, so to speak. Underwater is a good thing in this case. But again, go to rightpath2retirement.com or rightpathwm.com and get in touch with Jimmy and the team. And y'all have seminars and live events and things too that people can interact with you. It's not just a phone call or an office visit, right?
No, everything's about education. We do a lot of seminars. We do these podcasts. We encourage people to visit our website, listen to all the previous podcast episodes where they're going to learn a ton of information. But it's all about education. People kind of appreciate that style. And then whenever people want some help, we're open to that. But we just really want to educate the community.
But for sure, again, rightpath2retirement.com, rightpathwm.com. And again, you can call Jimmy and the team there in the office, 702-805-7000 at Right Path Wealth Management. Well, thank you so much, Jimmy, for lending your time today. And I know it's going to be a busy new year. It doesn't slow down when you got kids in high school, right? So we're glad you're back at it again with us.
Yeah, looking forward to Doug, and I'm looking forward to having a great 2025.
Amen to that. Thank you so much to Daniel Salerson, our producer, for getting this published out there, and to all of you for listening. Let's set some good financial paths, if you will, at Right Path Wealth Management. Starts by listening to the podcast here. Subscribe, whether it's Apple, Spotify, iHeart, or the other podcatchers, or again, go to rightpathtoretirement.com. I'm Doug Turnbull. He's Jimmy Lynn, the president, founder, and financial advisor at Right Path Wealth Management, and we'll have another episode coming your way very soon, y'all. Thank you.
Insurance products are offered through the insurance business Right Path Wealth Management. Right Path Wealth Management is also an investment advisory practice that offers products and services through Impact Partnership Wealth, LLC, IPW, a registered investment advisor. IPW does not offer insurance products. The insurance products offered by Right Path Wealth Management are not subject to investment advisor requirements. Investing involves risk, including the potential loss of principal. Any references to protection, safety, or lifetime income generally refer to fixed insurance products, never securities or investments. Insurance guarantees are backed by the financial strength and claims-paying abilities of the issuing carrier. This podcast is intended for informational purposes only. It is not intended to be used as the sole basis for financial decisions, nor should it be construed as advice designed to meet the particular needs of an individual situation. Right Path Wealth Management is not permitted to offer, and no statement made during this show shall constitute tax or legal advice. Our firm is not affiliated with or endorsed by the U.S. government or any governmental agency. The information and opinions contained herein provided by third parties have been obtained by sources believed to be reliable, but accuracy and completeness cannot be guaranteed by Right Path Wealth Management.